Hello friends, welcome back to my YouTube channel. I am Dr. Ahmed. I'm working physician in UAE. If you have not subscribed my channel yet, kindly do it now. Today I will discuss about an experience. I had an interview with a very well reputed hospital in Abu Dhabi, one of three big hospitals in Abu Dhabi. And I will share today my interview questions and I will give you some tips. Stay connected. Today I will discuss only about interview in a big hospital because small clinics usually don't go in this much detail. Maybe sometime we can discuss it, but today I will discuss only about my interview experience and interview tips as a doctor or medical professional in a big hospital. Okay, first thing is timing. You should be on time there. Sometimes there are problems of traffic and other things and any unknown problem, but anyhow, anyway, you have to be on time there. Okay, when I reached at hospital, I found some problem in parking and it took almost 15 minutes of mine, but I was almost 45 minutes early, so it wasn't a problem for me. So never go late. This will be your first bad impression. Okay, second thing is your dressing. Your dressing is very important. Sometimes it is as important as 30 to 40%. Where I went for interview, there they categorically told me that they have 50% marks of dressing, confidence, attitude and your respectfulness. Okay, 50% marks were for my dressing and confidence and how respectful I was and what was my attitude and everything. Okay, so this is very important. Never go in a casual dress. Try to wear a suit, a tie, good tie. Your hair should be well managed. Your shoes are very important. Never wear any casual shoes. Your shoes should be good quality and they should be polished. Okay, now my interview it was taken first by a medical director, then by head of the department, and then by another official. Okay, I will tell you in order what questions were asked from me. I will not separate it according to the person who was asking and what was he asking. Okay, I will give you a general outline. First question was introduce yourself. This is very tricky question and here they will check your confidence. Okay, your introduction should be short and precise. Okay, and as you know, everyone is different, so you have to make your own introduction. Okay, and my second question was, what is your professional experience? You have to tell it is 3 years, 4 years, 5 years, 6 years. Okay, including your internship or house job, that is also professional experience. If there is a professional gap, there is a gap in your professional experience in your CV, they will ask you straight away. There was a gap in my CV and they asked me and I had an answer for that. If there is a gap in your CV, your answer should be ready already. Okay, why you left your previous job? This is again a very tricky question. You should never use any bad words for your previous owner. Okay, prepare yourself for this question. I told them that they were very good people and I was enjoying my stay there, but it was a small facility. I want to join a big hospital, so they were very happy with my answer. Okay, never use any bad words or remarks for any of your previous facility or your owner. Okay, why you want to join our hospital? I told them that my passion is internal medicine, so I want to join your hospital because here I can excel and I can read more and I can learn. Here are in clinic I was the boss. Here I will have many bosses on me and I can learn from them regarding even administration and clinical everything. Okay, I'm giving you a brief. Okay, what is your future planning? I told about my future planning. You have to tell about your future plannings, but there is a trick here. Never tell anything in coming 3 or 6 months or 1 year that you are trying to move to USA in six months, or you want to do AMC and you are giving AMC and you will move in a year to Australia. Don't give such details, okay? It should be far future, at least 2-3 years away, okay? Next question was we have morning, evening and night shifts here. Do you have any preference? Technically you shouldn't have any preference. You should be ready for each and every shift, but if you really have any preference, do tell it at this moment. If you are a single mother and you have to take care of your kids in evening or night, this is the time to tell your preference. It may give you some negative marks, but if you get selected, it will help you in future, okay? What is your daily routine? Precisely tell your daily routine. Here they are just checking your confidence and the way you communicate. Your hobbies. Sometimes they ask your hobby in CV, and in interviews usually they ask your hobbies. And if you have many hobbies, like I have more than a dozen hobbies, don't tell each and every one. Don't go in detail. Just tell them 1 or 2 hobbies, and that should be some constructive or healthy hobbies. Like you can tell them reading, cycling, or traveling, chess, okay, or any other sports like football, cricket. You can tell these, okay? Don't tell them video gaming or watching movies. Are you married? If you are married, how many kids? They ask even about age of the kids, and how many dependents do you have? Where do you live here in Abu Dhabi and in your home country? Do you have driving license? What salary you already taking? As I was already working in UAE, so they asked me this question. What is your expected salary? This is very tricky question, and usually candidates hesitate to answer this. You should not hesitate actually. Before going to interview, have some knowledge how much salary they are taking there. Your colleagues are taking there at the same post, okay? And tell around that. You can tell in range, but range should be logical, okay? If you're telling that plus 20,000 or 20 to 22,000 or 22 to 25,000, it's okay, but don't tell 8 to 30,000, okay? How did you come to know about this position? You can tell it, you can tell the truth from internet or from any ad or from any colleague, okay? If we send you for patient shifting to other hospital, or we send you to some medical camp to see some patients there, do you have any issues? Technically you shouldn't have any issues, okay? How many languages you can speak? Can you speak Arabic? At this time, always tell the truth, okay? Knowing Arabic is your plus point, but this is not mandatory for doing a job in any hospital in UAE, okay? Translators are everywhere, so don't be over smart. Tell the languages you know, okay? Like I told them, I can speak English, Urdu, Hindi, Punjabi, okay? And I can understand a little bit Arabic and speak as a beginner, okay? Don't tell them that you can understand Arabic if you don't, okay? Do you have any chronic disease like diabetes? Tell them truth. It will not affect your job until unless you have any terminal disease. What is importance of documentation in hospital setting? Documentation in hospital is very important, and each and every person was asking me about this. How do you document? Which software you were already using? How you used to do this in your native country? And almost I think 5-7 minutes were spent on this single question. Okay, documentation is very important, and do be prepared for this question. Okay, if we offer you this job, when you can join? Here you can tell if you are working already in UAE, as I was working in UAE, and my notice period was 1 month. I told them, when you will tell me, I will give resign on that day. After that resign, I have to work for 1 month in that facility. Okay, tell the truth here. Okay, do you have BLS, ACLS or PALS? This is very important to get a job in any hospital setting. Some of the hospital can give you some time to do this if they really want to hire you, but better if you have already done all these. BLS, ACLS and PALS are must, and if you want to work in some good emergency, then ATLS. But these three are most important, and they should be from some AHA recognized institute. Okay, then they asked me some medical questions. First question was about an orthopedic patient, elderly female who had bilateral knee operated yesterday, and today you were called by a nurse and she had bleeding from surgical site. How will you approach? In this question they checked my approach, and during this scenario they asked me about blood transfusion, its products, when to transfuse, how much to transfuse, and what investigations you will do, and other fluids you can use, and their doses. Okay, second scenario was a patient with chest pain who had ST elevation, inferior leads, and they asked me about inferior leads 2, 3 and AVF, and basically it was a scenario of inferior wall MI, and they asked me how will you approach, and during that they asked me different questions: role of beta blockers, nitrates in inferior wall MI, can you give it in inferior wall MI or not, about beta blockers, and about PCI, and about aspirin and other drugs. Okay, and it was very detailed. And they asked me about the management of shortness of breath. If your patient is already admitted, and they asked me how will you approach. Okay, basically it was around the management of acute COPD, acute exacerbation of COPD, you can say. Then they asked me if you are routinely checking a patient and there are high values of potassium, so it was regarding management of hyperkalemia. And they asked me about abdominal pain in right upper quadrant. So you should be prepared for emergencies. These are all emergencies. Okay, electrolyte management, fluid management, blood transfusions and emergencies, these should be on your fingertips. Okay, this was all about my interview experience. If you have any questions, or you want to add anything, or you want to ask anything, use the comment sections. You can ask me, I will answer, inshallah. And see you soon with another video. If you have not subscribed it my channel, do it now. Bye.